look after more than 10,000 women who have babies in southeast Queensland across our facilities, and that's made up of a very large cohort of publicly funded women and also some privately funded women. All in all, we're the largest maternity service in the country and also the largest private maternity facility in Australia. Alongside that is our neonatology services, and our neonatal critical care units look after both the public and privately funded babies. And importantly, we're the only tertiary level private neonatal facility in Australia as well. We have 89 cots, making us a huge unit by any measure. As well, we provide general gynecology services, and that's both, again, for public and privately funded patients. And we have a number of subspecialty areas that we look after as well. And we've been known for our maternal fetal medicine services, which are dealing with some of the most complex babies, and babies that might even require surgery when they're still in utero. We're really at the forefront of making care safe, often enabled through technology. And there's a couple of examples of technology that I think have really helped to put us really at the forefront of safe healthcare in Australia. One of those is our use of the K2 Guardian system.
K2 Guardian essentially is an electronic recording of fetal heart rate. So that helps us to keep that trace forever. It doesn't fade like paper does, and it enables us to let multiple clinicians view the trace without having to enter the birthing space. Within the system of K2 Guardian, it's still reliant on individual clinicians making the classification. Of course, for the last year, we've also had infant technology bolted onto K2 Guardian, which gives us another level of safety because the algorithm in the computer itself is also classifying the trace and giving us its interpretation, which is just another amazing additional safety measure for our patients.
Infant has been incredibly supportive of clinicians in the interpretation of both normal and abnormal fetal heart recordings. Infant categorises the fetal heart rate patterns according to a traffic light system. Green aligns with a reassuring heart rate pattern. Amber with a situation where heightened vigilance is required, and red to a concerning situation where action is required to respond to likely fetal distress.
We're quite slightly unique in that we do a multidisciplinary handover with all of the treating team, all the doctors and all the midwives together, using the priority of the colour coding. We do that every 3 hours. Actually pages go off and people come every 3 hours to do a huddle around that board. We talk about everyone on the board, obviously giving priority to those that are red or amber and clearly in need of our greatest attention.
We are collecting data on the effectiveness of infant in terms of the outcomes for the babies born to mothers who have been monitored using this system. We're very much hoping that our figures are consistent with those from the international trial, which demonstrated improved outcomes for babies as a result of this artificial intelligence support of fetal monitoring systems. The Martyrs Pregnancy Assessment Centre, or PAC for short, was opened a little over 2 years ago in response to a need for women to have best possible care throughout their pregnancies. In the last year, we have seen 24,000 women through PAC. The results of our surveys have indicated that reduced wait times and a perceived higher quality of care has been something that has exceeded women's expectations.
Our human approach to making care safe is unmet in this country. The best example of this would be our presence 24/7 of a specialist who is on site and on call, available to our birth suite at all hours. No other hospital in Australia has delivered this level of safety.
The success of the on-site, on-call arrangement is thanks to the willingness of all of our specialists to participate in something which is quite unique within the health systems of Australia. The women are receiving more timely, safe care, the registrars are being supported in delivering that care, and the organisation is very much more secure in the safety of its systems. We are very proud to have been able to have this in place for 6 years, and I think it speaks volumes to the safety culture within our organisation.
We will continue to use that data and we'll continue to work as a multidisciplinary team to look at that data, to find our variation and innovate and help to make sure that care is always very safe at the Mater.